Hi, this is Dr. Robert Bates at Leominster Chiropractic Spine and Injury Center. Today we're going to talk about low back pain, what really causes it, how to prevent it, and how to cure it. But before we get into that, I want to give you a little bit of my background so that you will understand that I am very capable of helping you with your problem. I am a graduate of Clark University pre-med biology major and a graduate of Palmer College of Chiropractic, where I graduated magna cum laude. I am also a graduate of New York Chiropractic College with a diplomate in chiropractic neurology. So what actually causes low back pain? First of all, there are certain fibers called pain fibers in certain tissues in your low back. They must be stimulated by inflammation or mechanically to give you a sensation of pain or suffering in your brain. Now, in the low back, there are only 3 of the 9 ligaments that attach bone to bone that have pain fiber. The posterior part of the disc, the posterior joints, and one of the posterior ligaments. There is also pain fiber in other soft tissue and in muscle. So you can have inflammation developing from mechanical damage, trauma, or chronic long-term dysfunction, which is usually what is causing back pain. So ultimately, to develop back pain, if you do not have direct immediate trauma, then you have a dysfunctional low back, meaning that things do not work properly. The joints don't move properly and tend to irritate the capsule. You have a possibility of some arthritic change and fixation and degenerated disc that can also change movement patterns. But ultimately, most back pain is dysfunctional, meaning that it just does not function right. The ligaments are too long and too loose or too short. The muscles are too weak or too short or too long. The joint capsules don't function right and have lost elasticity. The posterior disc is bulging because of chronic problems in flexion, loading, and sitting too much. But ultimately, it is a dysfunctional problem. As an example of this, I very often have people come into my office with a disc bulge or several disc bulges or a disc herniation documented on MRI. And that, of course, can irritate nerve roots and give you severe leg pain and atrophy of muscle and other neurological loss. But you must remember that the disc did not create a problem on its own. It was a dysfunctional low back problem that caused rotation and too much flexion and tearing of the annular fibers in the disc, which ultimately allowed the nuclear material, or 80% water, like a jelly, to push through the tears and create the bulge. So you do not have disc disease originally. You have an abnormality of function of your low back, which causes tearing in the disc and then gives you a disc problem, bulging or herniation or free fragment, that of course becomes very symptomatic. Let us talk briefly about prevention and curing a back pain problem. The first thing that you need to do is have a very thorough evaluation to find out what you are doing in your daily life and what your low back actually functions like. And this can be altered by spinal manipulation, by various physical therapies, and by specific exercise. But ultimately, we must find out exactly what the functional problem is in your low back. There are many differences in people, and that is what is sometimes comical to someone who specializes in this, when general exercises and general procedures are given for all types of back pain, when a very specific program is necessary to fix your problem. At my office, I perform a very thorough history so that I can find out exactly what has happened to your back over time, see if there are any injuries, and see if there are any chronic abnormalities. I then perform a very thorough examination, including orthopedic and neurologic testing, which lasts about 45 minutes. We check for various spinal movement at all levels and muscle strengths, and if there is any neurological loss. When I get all of this information, I am able to set up a treatment program that is very specific for you and has the best possible chance of resolving your back problem. At Leominster Chiropractic Spine and Injury Center, we treat all kinds of low back problems, including congenital anomalies, post-surgical failures, which, by the way, are over 50% at the 3-year mark still today. And we also use various types of treatments, including spinal manipulation, which is the only thing that can restore normal coupled motions in your low back. I also have various types of physical therapy, including several types of electrical therapy and red light laser, which is very good at increasing energy in the cells and helping you heal and alter your low back. We perform a thorough examination, and this allows us to perform an adequate and very specific rehabilitative exercise program. And actually, in the literature right now, if you do not perform a specific exercise program with your low back pain treatment, it is not even considered a credible program, because 90% of the stability of your low back is muscular. And to bring back slow twitch fiber is difficult if it has weakened and atrophied. As part of our rehabilitative exercise program, we use a vibratory plate, which was originally developed in Russia for the cosmonaut space program. And this is an incredible piece of equipment. We can rebuild muscle, make muscle grow much faster than with other means. It doubles blood supply and it increases bone mineral. It also tends to stretch muscle as you exercise so that you do not get shortening and stiffness. It is great for core rehabilitation, and I use it exclusively for core work, and it builds core strength very rapidly. So if you are one of the unfortunate Americans that has developed a back dysfunctional syndrome with pain, with or without leg pain and disc involvement, treatment shown in the literature, as we perform at my office, gives by far the best short and long-term result to cure and prevent further back problems. So I hope to see you in the near future if you do have a back problem, or if you want to talk about ways to prevent having a back problem. Have a great day.